Efficiency Unlocked is hosted by two tech-savvy physicians and dear friends of mine, Drs. Adam Carew and Dale Gold, who are experts in using technology to automate routine tasks and increase efficiency in everyday and business life. Let's see what they have for us today.
And then, you want to, when you're trying something out, whether you're doing something new, you want to find your tribe, right? Who's interested in what I'm doing? Who's already blazed this path? Can I find a mentor in this? And so I like trying to help kind of facilitate that for folks, because it is, as you mentioned, there's a lot of trepidation when you say, what am I going to do with this new phase? But what does that look like? Who's done it before? Who can I even talk to?
That was Dr. John Dayton, our guest from Stanford and Intermountain Health, and one of the earliest innovation fellows in emergency medicine. With nearly 2 decades of clinical experience, John's also helped build startups, advise venture funds, and lead some of the first academic industry collaborations in digital health. He's a physician who believes we can and must upskill far beyond the traditional playbook.
How did you start? What did you do first? And you end up kind of saying, oh, well, these resources I found were really helpful. Maybe this one not so much, but you kind of go down the same path. And I thought, I've always wanted an excuse to kind of put it all out, in one document that could kind of evolve as new resources, were found.
So what does physician upskilling actually mean today? Is it mastering AI tools, leading clinical pilots, or just learning to speak the language of innovation? In this episode, we explore what it takes to stay relevant and why every physician should see themselves as a lifelong builder, not just a lifelong learner. Let's jump in. Today, you just have me as your host. Dale's grinding in his new job, but I'm super happy to have Dr. John Dayton here. You just heard that intro about him, but I think John has combined a lot of things in his career. First and foremost, he's an emergency physician. He's an entrepreneur. He's really kind of passionate about this physician upskilling concept. And I think that's obviously the topic of today. We're going to talk about that because I think there's a lot of physicians out there and just frankly, all clinicians who want to do that and figure out how best to do it because it's not being taught in med school, right? So John, welcome to the show. Thank you for joining us right when you came back from Health Europe. And you're probably jet lagged, but you're an ER doc, so you can do it.
Yeah, I'm always running on a little bit of sleep, and that's just kind of how I run. But hey, thanks so much for having me. Such a pleasure to be here.
No, I'm looking forward to this convo, and obviously I wish Dale was here because I think Dale always brings this different kind of thought process than I do. But whatever, you got me today, and I got you. So, so I guess I want to start like we always do, where we talk about the person and you a bit, and obviously I just said this thing about you kind of being this mix of someone who's in kind of the tech space and entrepreneur space and also a practicing physician. But can you talk about the experiences in your journey, how that led you to kind of get to this point where you really do want to prioritize this professional development piece and kind of upskilling beyond just the clinical medicine piece?
Yeah. No, I really appreciate that. It's a major thing for me, and I think it's important for anyone who follows a policy of wanting to design their life and wanting to kind of work intentionally and do what they want to do. It's tricky to figure out, what does my ideal life look like? How many shifts is that, and how do I stay clinically relevant? And if I want to do other things, does that enhance my ability to be a doctor? Does it and conversely, does that enhance my ability to be a better advisor or innovator if I'm practicing and current? And so we have to be careful. We all have the same amount of time, but I think at some point you realize what your priorities are and how your life should be, and maybe let's get a little bit audacious and try to figure out how to do that. I like to be an ER doctor, but I like to be involved in folks that are designing tech that we're going to use. I like to be involved in figuring out where medicine's going, where emergency medicine's going. And so, unfortunately, as more of us, as more physicians or employees, rather than, owning our own gig or running our own gig, it's kind of imperative to kind of set yourself out to say, hey, I want a seat at this table. If I looked at that kind of earlier in my career. I got involved with health policy because I think a lot of us have this attitude, well, if I'm a good doctor, I take care of my patients, community is going to take care of me. And I don't necessarily think that's the case. I think the best way we can advocate for our patients is saying, hey, you know what, we need some better funding for EMS control, and we need, better health initiatives, and let's be involved in making sure folks get vaccines and, get rid of a lot of the misinformation out there. And I think it comes from us. We're physicians and we're good at practicing, but at the same time, our voice has value as kind of authority, but also, that same background has value in business. Someone's wanted to take something to market. You want to figure out what your user experience is going to look like. Ask a physician, do they even want what you're building? And would they incorporate it? Maybe they got some feedback for you. And so I'm kind of bouncing all over the place, but those are kind of the areas where I like to be involved in health policy and innovation.
Yeah, no, and obviously you have an MBA, and I know that's always a hot topic in the physician spheres, right? It's like, do you need this MBA? Like, is that like the ticket in, or is it, I'd love to hear just your thoughts on that, because I obviously have some opinions on it.
Yeah, I don't want to paint like a broad brush and say, oh, if you want to be involved in this, you need to get an MBA. Mine is very focused on what I wanted to do. It's kind of very aligned with my career goals, and luckily I went back to school and did a fellowship, and they gave me money towards an MBA. So I thought, well, great, I'm going to do the one I can tailor on what I want to do. So my is very it's very specific towards healthcare innovation and entrepreneurship, and I took a lot of classes around venture capital, which is what I like to be involved in.
Yeah. Good. And I wasn't like alluding that I'm like anti-MBA. Maybe it probably sounded like that at first, but I think for me, it's more, I think there's so many of us that are kind of lifelong learners, right? I mean, we're lifelong learners on the clinical side. I don't think patients always realize that, like how much your doctor, it's not like we went to school, learned everything, and then now we just regurgitate,
Yeah, check the box and we're done, right?
Yeah. I mean, I think it's like you're constantly learning. Like, I mean, obviously, what came out when I was in training is totally different than a lot of the stuff that we do now. And,
absolutely,
across the board.
Patients are more complex.
Yeah.
Patients also have more resources, so we need to be up to speed on both of those accounts.
Yeah. And so like in the same way though, like obviously when a physician wants to get into the business side of medicine or understand details of it, you have to learn somewhere. I mean, I guess if you're like a millennial or younger, I mean, you probably go to YouTube to learn some of that stuff. And maybe that's where you can get the MBA kind of like via YouTube now. I mean, honestly, you probably could. I bet there's probably really good content out there. Or now with LLMs, right? I mean, you can just basically ask it a question and it can teach you something. I guess you don't know if it's teaching you BS or the right thing, but you could at least use it as an education tool.
Yeah, as a platform. It's an interesting topic. You mentioned I just got back from Health Europe, and I was on a panel and we were talking about modernizing medical education. And at the core of it, becoming a physician means that you have a grasp of knowledge that you're able to implement, and you need to utilize it. And we get knowledge in different ways. When we were in med school, it was all textbooks. Now they have a lot of online resources, small group learning, that sort of thing. And then, what was our textbooks and journals? Now, we see journal articles that get spread through social media. We see things get a lot quicker and a lot bigger uptake. And so when you're deciding how you want to do it, we have the old textbook on this is how you do a procedure. And at some point after we learned that, we transitioned to, all right, I haven't done a chest tube in a little while. I better pull up I think patients might be horrified to think that we watch like YouTube videos, but it's like content that's curated by a residency program. It's showing,
it's quality stuff.
Yeah, absolutely. But now it's gone for a textbook, it's a procedure. And now I'm like, all right, I'm going to jump on OpenEvidence because I don't see this clinical presentation very often. What are the can't miss things? What are the labs I may be forgetting? And so it's having that core knowledge, but utilizing it and applying it in the healthcare situation.
Yeah, that's why, I think, people that use, we don't have to go on a tangent on like ChatGPT and Claude and everything, but I think it, whatever your profession is, if you're a realtor, if you're, accountant, if you're a lawyer, whatever, those tools they're not replacing what those people would do. But if you really use it to your power, And really open evidence, for those that don't know, like if someone's watching this or listening to this and is like a patient, I mean, you can think of open evidence as like, it's like the chat GPT of like medical knowledge, and journals. And I mean, obviously I use it constantly. I'm always like
absolutely
confirming my hunches or confirming like, what am I really supposed to do in this? But it, so I think like these tools are crazy that you can just, I mean, everyone should be upskilling themselves, honestly, with these tools. That's like, if you're not using these, like at least just start playing with them. Like,
yeah, absolutely. It's like anytime an innovation comes along, right? Like, we have calculators, but we still learn to do math before we use them. We have, accountants use Excel, and at one point that was considered, you should just do it the long way. It's cheating. And then we realized, no, it's okay to utilize the foundational knowledge you have to be more efficient. It's like Graham Walker's MD Calc, right? Like all of us learn those, equations and algorithms at some point, but also that's a lot to remember. And I'm not above saying, hey, I need a little bit of a crutch when I'm trying to think of an Apache score,
Yeah, correct. Yeah. Because for me, I've always had, I think obviously anyone I think who becomes a physician was probably a good student, but like I actually had trouble like memorizing facts, like just pure facts. Like if there was no connection to it, so like for instance, when I was going through biochemistry in med school, I hated it because like I literally just thought I was memorizing like these like weird steps, of like some sort of cycle. But it's like, I think if I would have gone through training where they were teaching it kind of that whole systems way, or like, I think a lot of med school education has gone, but like, yeah, if they were teaching it like why we were learning this cycle, because if you don't have this enzyme, you're going to have this disease, which looks like this and, presents as this way. Like for me, like, I don't know, my unlock in med school was like third year. Because all of a sudden I finally got to apply all that stupid crap that I was like learning the first 2 years.
Like, the foundational knowledge makes sense now that we're applying it, right?
Yeah.
They can only implement it a little earlier.
Yeah. And so that's like now, I mean, I tell patients all the time, they're like, how do you like remember all this stuff? And I was like, I don't. I just have like a really good kind of like indexer of knowledge. And then obviously some things I just know down pat, like treating a UTI. Obviously I know how to do that without anything, but like everything else, I know how to find the answer extremely fast. And so like, I just think that's like the same notion of like, kind of upskilling yourself. I mean, if you're a clinician and you want to learn how to do something else, you got to find ways to like get educated, right? And learn. And that's like, I know recently you just kind of published that really great resource guide, which I hope was like in concert with you being on here too. I assume it was probably inspired and kind of timed, but I mean, it got a lot of buzz on LinkedIn. And so, yeah, can you talk a little bit about that and like, why that really does, like, why are you kind of so passionate about that?
Absolutely. So a couple of drivers behind that. I like for learning to be collaborative. I like to, source my colleagues who are really bright. And so I had recently worked on a similar document with Rehan Faroqi. He had organized it on a document for AI tools for medicine. If you're an innovator or you're,
it was great. That's a great tool, by the way. Yeah,
it was amazing. He collated a lot of information. He asked a bunch of experts, and I thought, well, this is perfect. Let's do the same thing. Because a lot of times, anytime you do something outside of clinical work, you have people say like, well, how did you start? What did you do first? And you end up kind of saying, oh, well, these resources I found were really helpful. Maybe this one not so much, but you kind of go down the same path. And I thought, I've always wanted an excuse to kind of put it all out, in one document that could kind of evolve as new resources, were found. And so I did the same thing. I went back to Rehan and grabbed other colleagues like Graham Walker and Sarah Gaybauer and Ethan Go and some other folks that had collaborated on the first one and said, hey, this is what I'd like to do in this space. And I find that a lot of physicians, they want to know about medical business, digital health and innovation. And a lot of folks are interested now in social media, whether that's physicians talking to patients or physicians talking to other physicians. And so tried to find some resources along those. And so a matter of trying to find, there's the formal resources like the, combined educational programs and the fellowships, but there's other ones that are more kind of bite-sized and for everybody to start with. And that's, an online community or maybe which journals or maybe which conferences. I think a lot of times, as an emergency physician, I went to, American College of Emergency Physicians Scientific Assembly every year. And that's a great college. It's a great conference to teach you how to, become a good ER doctor, keep your skills up. But I really like to go to conferences like Health and Vive and NextMed, because these are collaborative with other specialties, but they're also like medical futurism, and I like to be involved in those as well. And so I think a lot of times for physicians, they say, well, I want to do these other things, but it's like you kind of got to step off that, med school, residency, scientific assembly, treadmill, and say, if you want to learn about AI, you're probably not going to get the best training, at a specialist society conference. Now, hats off to ASAP. They have a brand new collaborative effort. We're looking at AIs that's going to, change how we practice and future workforce. Now it's going to be integrated, and they're very forward with that. But that wasn't available, 5-6 years ago when folks wanted to learn about how do I apply AI in my practice. And so you have to find different resources. And so I think there's some hesitancy and some nervousness with doing something, outside of the approved clinical role, and kind of taking a step out. Some folks are a little nervous about that. And so there's a lot of hesitancy and trepidation, but trying to find the right resources and things to kind of validate that a lot of people want to do this. And these are things that people are looking at.
No, it's super interesting. I mean, obviously what I just went through last August, stepping out of a big organizational kind of executive role into this space, which I had obviously been contemplating for years. But to your point, I was just honestly, I didn't have the courage to do it yet, because I was just I don't know what I would do. And I wasn't I honestly wasn't, I tell people this all the time, I actually wasn't burnt out, in the sense of I hate my job and why'd I go into medicine? It was more I was just really interested on frankly, in people like you and others that were kind of had found a way to mix things together and get this experience. So I think it's I think this is just a cool way to, for physicians to start dabbling in that interest, because we all have other interests, and some of them might be investing in whatever traditional or non-traditional ways. I mean, get involved in that. That's those types of, there's the white coat investor that, is actually in your neck of the woods. And he started that as an individual blog, and now it's an empire. And, I just think there's so many things that you could just tangentially get involved in. But I see
Absolutely.
you too, you've created other resources. I feel you always, that's actually how I was trying to think how I first found out about you. And I think it was Health many years ago, and that, the little aggregator that you put together, that was the first, I know it was probably, I saw it on LinkedIn or I saw it somewhere, but I just think, that it fits this, creating this resource guide for upskilling specifically fits with what I've seen you do in the past.
Oh, but I appreciate the kind words. Yeah, health is interesting because, here you have the announcement of, all this great tech that's coming down and that we're going to be eventually using, whether it's ambient scribe or EHR updates. And there are so few physicians there. And so when I went to the meeting the first time, I thought, someone needs to make a guide for hey, if the docs are here, how do we connect with each other? Whether we're, practicing clinically, whether we're doing, academic leadership, whether we're working in business. And so I tried to find different speakers that were physicians and highlight physicians that were attending. And then that kind of grew to groups like Scrub Capital, and Physician Side Gigs now has a very big role where they've taken on CME. And it was just a perfect place to say, cool, we're all here. Let's gather and collaborate. And it's real fun to hang out with, what's gone from a handful of physicians to, 100, 200 of us at these events. And then, you want to, when you're trying something out, whether you're doing something new, you want to find your tribe, right? Who's interested in what I'm doing? Who's already blazed this path? Can I find a mentor in this? And so I like trying to help kind of facilitate that for folks, because it is, as you mentioned, there's a lot of trepidation when you say, what am I going to do with this new phase? What does that look like? Who's done it before? Who can I even talk to?
Yep. No, you're like a connector. That's really what you're doing. And I guess along these lines, follow up to that question just about this resource guide that you've put together, which we'll obviously link to it in the show notes and everything. But is there one skill or resource on there that you kind of think, or that you wish maybe every physician would kind of start with? Something that you just think is so valuable? Yeah.
That's a phenomenal question. The research is comprehensive, right? There's everything from following a thought leader to figuring out a combined degree program. But I think the core of it is finding your community there. Like if you want to be involved in healthcare investment, cool, find an angel group. A lot of them are healthcare focused. A lot of them love physicians because when I got involved in the one in Salt Lake City, I realized that 30% of the deals that were coming were healthcare related. So they really relied on me and two other physicians that were part of the group to kind of vet the idea and say, this has legs, this doesn't have legs. I would use this. I would never use this, And so that's a place to start there. If you're interested in, innovating, find somebody that's doing something that you're interested, that you're passionate about, and join that. This is kind of an audacious story, but I'm really into health data operability. You don't have to convince an emergency doctor that having patients' health data is helpful when they're being seen in the ER for the first time. I can sit in front of a computer. I can try to get a lot of faxes. I can talk to them and they'll tell me they take the green pill or the white pill, depending on their level of health literacy. But if you have a resource from another healthcare system, like, Epic's Care Everywhere, then that you can utilize that to dial in. And so I reached out to Jonathan Bush, who had started Athena Health, and now he was doing Zeus Health, focus on health data interoperability. And I didn't have a formal role. They weren't advertising a position, but I said, hey, listen, you guys don't have a physician advisor. I can help a lot talking about why transitions of care are important, talking about getting your information to physicians, what that user experience should look like. This is something I'm really passionate about. I'd love to be involved, and that ended up becoming a part-time advisory gig. That's a great experience here. It's a major company. It's Andreessen backed, and I was audacious enough to cold LinkedIn everyone I could find working for them and say, hey, I want to be part of your team, even though you're not even offering a job. And so that, something like that. But that was something I was passionate about. They appreciated that passion. And they also appreciated that insight.
No, that's it's so super interesting. I have so many thoughts after that comment. And I don't want to occupy time of me talking because I want to learn more about you, but I'll give one little story that ties into this. So when I was a CMIO at Kaiser, we were really trying to push for problem-based charting, in Epic, because, and literally the example I would give I'd be because, we get some specialties that'd be no, just look at my note. My note has everything that's important from cardiology perspective or GI. And I'm well, that's fine if somebody looks at your note, and my whole thing was the biggest case I would make, I'd say the problem list needs to be good enough that this patient can walk into an ER and that ER physician or whoever clinician is seeing them, immediately has this amazing snapshot of that patient.
Yeah.
And that was the example I always used. And I was imagine if a patient came to you and you had no information on them, but you have to do a cardiology consult and you only have 20 minutes or 10 minutes or whatever. I was you need that info quick. And I'm confident some of these AI tools will be better. Oh yeah, go ahead.
I was going to say, at your very base, you need an old EKG, right? And where do you get that? What's the universal system? You need to know any information they've had on cardiology testing. You need troponins or other, germane levels, but often that's, from different labs, and who's going to collaborate and then bring that together. And so that's why I was totally interested in working with Zeus and trying to kind of drive some of their product along those lines. Those care transitions are crucial. Not everybody's on Epic, and not everybody, even if they're on Epic, has a Care Everywhere document that's usable. Sometimes it's all their demographics before you even get to anything, that they actually need to take care of them.
No, it's cool. I think the crux of what you're talking about is find something that you're passionate about in your clinical domain, even, and seek those things out. And I think, your advice about the community aspect too, find the community. There's that's what I did. That's why I joined Clinicians Who VC, not because I had all this crazy investment advice, but I was I just want to be involved with people who
These guys are doing what I want to do.
Yeah,
absolutely.
Yeah. And it obviously that's how I found the job at general medicine. There's all these, that's the cascade that started, for me. And so, yeah, that's my advice I always give people too is find a community. And there's so many digital versions of that out there now. It's not.
Find your tribe and run with your passion.
Yeah. Sweet. All right. So let's talk a little bit kind of deeper, I guess. There's obviously a lot of professional development type things out there, different platforms. I think talking about the guide you made and kind of your approach, what kind of makes that different? Or, more usable for the busy physician who's probably dabbling with this stuff on the side between a full-time plus job?
Yeah, great question. I try to include things that, the bite-sized things, finding your community, or, finding a clinical course you can find online and something that you're interested in, all the way to the level of, what does your specialist society offer? Who are your thought leaders in that space? And then let's say you're going to, make a major jump, you're going to go back to school, or you're still in training and you do a fellowship. I try to include all of those. And so, it's tricky. You need to analyze where you are and where you can go from there. And I think a way to do that is to find the resource that's appropriate for your situation. So try to be extensive enough to include those. But just going back to physician side gigs, I think, Rebecca and Jonathan have built something amazing there because they've tapped into a lot of physicians that want to invest. You attend one of those meetings, someone gives a presentation, and then they divide up, well, who's going to, do this? And all of a sudden it's like journal club. All these talents that we have to be super analytic, this is a way to kind of channel that skill to saying, all right, well, let's put this in the real world. And so I think they've really figured out how to collect folks who have that interest, but also are super capable in representing multiple specialties. And as you mentioned, there's such great networking that happens in that group.
Yeah. And it's crazy when you just put a few good minds, I had a meeting this morning with, one of our leaders in general medicine, and then a musculoskeletal, kind of expert, a primary care sports med doc who I'd met through another community. So there we go. That's how he got looped in. But, it was the three of us. And so it was myself as a generalist informaticist, this musculoskeletal kind of digital forward thinking physician, and then an engineer who's one of the co-founders. And I just, we met for an hour and a half this morning. I don't know the last time I had an hour and a half meeting, but the three of us, the way we were kind of riffing off each other and actually figuring, how best to maybe think of musculoskeletal care different in a digital domain, just outside of the normal rules. We came out of that with this great, I'd say this great initial playbook for us that we're going to go pursue, and it's just so fun when you're around other people that have different talents. And
you take your three areas of expertise and you could figure out a whole pathway, right? What can be done remotely? How do we utilize the resources we have? What do we, and then how do we plug that in for remote patient monitoring, or how do we make that a billable thing? But ultimately, how do we change patients' lives? And how do we build a business or a project that I'm excited to get up, to work every day instead of burning out?
Yeah, no, that's the big topic that we talked about is I think this is missing in medicine, and this is getting a little off of our topic, but I think it's related, is that what I don't think we do a good job in medicine of, and this is just general, is we don't really get down to the specificity of the reason for the patient's concern. And what I mean by that is say somebody thinks they tore their ACL, as an example, if this is someone who's in their 50s and just, isn't playing basketball or pickleball or anything where they really need an ACL, for them, it's they may still want to know that they tore their ACL, but they probably just want to know so they know what the right path forward is, versus somebody in the middle of winter season where they have 6 ski, trips planned all over the place, and they probably tore their ACL on the first one, and it's I feel those two patients in our current kind of system, they would both get treated probably the same, meaning they would probably either go to urgent care or see their primary care doc. And then both of the advice would probably be well, let's let this cool down. And we'll see in 4 to 6 weeks. And then we'll consider an MRI and stuff. But it's those two people have really different needs. And so I don't know, that's where I think having these conversations with other people, you start to realize these little side things of just how we can kind of rethink even how we're doing things. So segue, but kind of a fresh on the mind, based on a combo this morning.
That makes a lot of sense.
I mean, that's why Dale and I started this podcast. It's we obviously just wanted to have great conversations, but then be able to share it with the community and even, patients outside this our specific domain of medicine. But like what we've learned is like selfishly, it's like a great way to learn and meet people and like actually learn ourselves. So we've like, it's, you know, it helped us learn so much about like the AI scribe game as that was blowing up, because we just said, let's just interview all of them. Like, why not? Like, just send an email and yeah. And so we got to like have this really nice like breadth of knowledge. So yeah, it goes back to that lifelong learning thing, which, you know, I think most of us have in us in one way, shape or form. So I guess a little bit more under the hood kind of question too is like, how do you filter out the noise of this and like kind of, you know, because I think like everyone's probably going like, maybe they want to do something, but they don't know like exactly. And I know you gave that one example of like finding your kind of group initially, but like, how do you like, yeah, I mean, if you're having like competing kind of thoughts, how do you like filter out that noise, like even in your head or whatnot? So you really do something that's really worth, you know, biggest bang for your buck type of thing in a limited.
Yeah. And I think that's a great question. I think it all goes back to figuring out, you know, what do I want to do? Am I interested enough in innovation and investing that I feel like I want to reposition my career, get additional education, and you know try to go out and join a VC firm, or am I interested enough that hey, I just want to find a cool startup I can advise, or join like a group of physicians that are investing in it, you know, with an angel group. And I think it's figuring out, you know, what extent you want to do something different. You know, I think COVID affected all of us differently. A lot of folks, you know, really changed what they were going to do at that point. Pre-COVID, I'd been involved with Society of Physician Entrepreneurs, and I've been involved with some, you know, kind of lobbying efforts for some health policy work. And I was in a situation where I was working on the Navajo Reservation, and I was loving it. I was very useful. I worked in like, you know, spacesuit, and I took care of people and made life or death decisions, and in an austere environment. And professionally, it was, you know, rewarding, and you know, as far as the community, it was very helpful. It was also really demanding. You know, I was driving from Salt Lake down to, you know, Chinle, Arizona every week, working a week worth of shifts, coming home, trying to like get caught up on sleep, binge parent for a couple of days, and going and doing it again. And I think, to me, I reached a point where I'm like, you know, this is just hard. I'm solving things, you know, professionally. I'm making an impact, but this is a point where I'm just going to burn out. And I think when a lot of folks, if they don't see doing what they're doing, you know, in perpetuity for, you know, 20, 30 years, I think it's time to start thinking about, well, you know, what are my options? And so I started investigating at the time. And that's when I actually was looking at MBA programs, and I realized there was a innovation program, a new fellowship. And so, you know, I thought, you know, if I'm going to pivot at any point in my career, this is going to be it. And the culmination, and this is a sad thing. I'm sure a lot of us experienced that. I had just a friend who died by suicide during that time, and that was pretty impactful. I don't want to just say like, oh, you know, we're all headed there. You know, it's very specific and very sad for that person, and people experience things differently. But I thought, instead of feeling horrified when I found out about it, I thought, yeah, if I was doing this day in day out, you know, didn't see any change, I get that, and that really made me nervous. That instead of thinking, you know, instead of, you know, just being horrified by the idea, I totally got it. I was more empathetic than I found myself comfortable being, and I thought, you know, this all sounds very dramatic, but this is when I would like, you know, I am going to change what I'm doing, and you know, maybe I will do something wholesale, and not everybody's going to get to that point where they're like, all right, I totally got to step away, and I don't even plan to step away. I feel like as long as I'm an emergency doctor, that gives me value, you know, in academia, you know, teaching, and it gives me academia advising companies. And so I feel like being a good emergency doctor helps me do these other things better. But I think there's a time where you have to figure out, what do you want in your life, and how are you going to structure it, and what does that look like? And I think with that in mind, I think you're much more motivated to be like, all right, well, let's look at my resources. Let's talk to the people that have used them. Let's, you know, connect with folks who are in the same space and thinking about the same thing. And, you know, you go to a community like MD++ or physician side gigs, and it's validating to feel like, oh, I have other people who, you know, you don't need to read the Medscape, you know, survey every year to be like, yeah, I can tell a lot of us burn out, right? You feel that, but it's validating to other people like, yeah, I like that, but I also like being a doctor, and I like making a difference. how do I do that and incorporate that into other things that I want to do?
Yeah, you're speaking my language. I mean, that's like been my MO. I think I realized that too, even in med school a little bit. Like I originally thought I'd be a cardiologist because I had like this exercise physiology background. So it was kind of like a natural kind of way. And then I was like toyed with orthopedics because I had like a sports and kind of, exercise background and too. So I was like, oh, that'd be kind of fun. But then I like kind of like reverted back to like, no, I think I'm just, and this sounds silly, I think people are going to be surprised. I actually didn't know what family medicine was when I went to med school because I never had one growing up.
I don't think any of us knew half of the things, or we had an idea, right?
Yeah.
But until you're like rotating, you're like, oh, this is what they actually do. This is what
and
my
then
life
I was like, wait, I was like, so I could be this like super generalist where I could like, if I wanted to, I could take care of kids, I could do sports med, I could take care of pregnant women. Like there was like all these things that, I think as a young med student, you're just kind of like, oh, this sounds cool and exciting. But it like, I think that's what initially drove me to it. But then it also, I was like, oh, I'm going to be interested in like other things. And that's, it kind of like led me into kind of doing more EHR stuff and, ultimately informatics. But yeah, you just got to you have to follow your passions. I mean, I think that's like the biggest thing. So I do want to ask you this kind of specific question around this. Like,
Sure.
Like, what do you think has changed, or like, and specifically like with this upskilling, why is it like a topic now, in 2025? What do you think that's changed that's kind of like made this different now?
I think it's a convergence of a couple things. More and more physicians are employees, and no matter how your hospital incorporates you or how your job is, most of us feel a little bit like we're becoming cogs, and so that's frustrating. So that's on one side. On the other side, we have brand new innovations that are really going to change how healthcare is practiced. You look at the potential we have with AI, whether it's using NLP and large language models, or CNN for the images, or like multimodal AI. It's going to drastically change how we practice medicine. And so I think there's a situation where there's some frustration, in being employees, but there's also an understanding that there's a lot of innovation that's coming forward, we're physicians, we're type A's, we're the ones who wanted to be the head of the class, we're the ones who did the extra projects, and so we want to be involved in what's new. And so I think you have kind of those two things coming together, where you're having like physician dissatisfaction. At the same time, there's so many opportunities. And then, you have, you look at ways that younger docs practice. When we were old, it was, we were training. It was like the worse your residency is, the better badge of honor you wore. And it's like, that's such a ridiculous, like mindset, right? And so some people are like, oh, Gen Y and the younger generations, they're soft. And it's like, and there's all these conversations you can have about different generations, but they get that they want to work at a place that supports what's important to them, and they get the importance of lifestyle. And I think a lot of us, COVID was kind of the tipping point where we're like, maybe it's not awesome that I'm killing myself to be a doctor. Maybe it's not awesome that my mental health is not great as a result of all these pressures that we put on ourselves. And I'm in a position where I can change what I'm doing. And so I think you have kind of these confluence of a lot of different influences all coming together.
Love it. That's such a great way to kind of wrap the big thing is. But I do want to ask you some nerd alert round questions that we don't give our guests ahead of time. But I made it this time. Like I actually picked ones that I think align with what we just talked about. So it's kind of interesting. They'll be like personal to you, but like along those lines. So that's, at least you can get in that mind space. But obviously take your time with answering these. I always edit in the show to make it sound like the answers came out right away and flowed off the tongue. But I guess, so first question for you, I've asked this to others, but it really fits this. Like, is there still a skill that you want to master, either professionally or personally?
Oh, there's so many things that I need to be better at. Did you ever watch Bill and Ted's Excellent Adventure? And Bill and Ted, they meet, Socrates, they call him Socrates, and he says, true knowledge is realizing you know nothing. Like, that's us, dude. And that's how I feel like. I feel like the more I learn about something else, the more I realize, boy, I'm just a novice and I have so much I need to learn. So I feel like I'm going to spend the rest of my life trying to become a better emergency doctor. At the same time, right now, I've taken some experience that I've had as a limited partner and a venture partner doing VC work, and I'm raising my own fund. And I'm really focused on, hey, how do I do this differently? And how do I get more healthcare voices involved? And how do I make it something that's successful? That's one area where I'm really focused right now is effective venture capital in medicine.
Yeah, I love it. That's awesome. So follow-up question to that. What is like something that you've learned recently that you were like, wow, I can't believe I didn't know that, or that was a great, add to your repertoire?
Oh, it's a great question. So a lot of times when we look at AI, we're like, what can we do with it, and how's it going to help us, and what do we need to be nervous about? And I've kind of been looking at different options and different ways to use AI in my practice. So Graham Walker and Sarah Gebauer, they did a webinar like a week ago, and they talked about different ways you should implement AI, and if you're not doing it, the resources you should use and how you should, kind of overcome fear or whatever. But what I've been doing a lot lately is I've realized a lot of the EHR instructions that we give patients are just so vanilla. They're almost like to the point that they're like cautious enough that they can be helpful, but not specific enough, to be, cause any trouble. And so I've been using OpenEvidence a lot to say, here's my situation, here's my patient, here's their diagnosis, here's who they're following up with, here's what I really want to emphasize in their, follow-up, instructions. Can you write this, according to this, education grade level, and focus on this specific element that I don't have a great, handout in the EHR for. And so I found that is really a nice way to personalize medicine. And so I've been trying to do that. And then a lot of times, I see folks in populations that aren't always English speaking. So sometimes if you can take that initial information and then translate it, and, that obviously, takes some time and figure out how to work through it. But I find that, anecdotally, I don't get, bounce backs for some of the same kind of things I used to see. And so hopefully that's, if you personalize those care instructions, it's more helpful to the patient and it's better medicine. And so that's one area where I've been trying to utilize AI more recently.
That's cool. Yeah. I mean, that's like the last thing the patient remembers is usually the thing that like, I think sets the stage for that encounter. So even if it didn't start out well, like they had a crappy experience, if you give them this super personalized, like patient instruction, like that's like really, that's cool. That's very cool. I was also going to say Graham and Sarah's like thing was super cool too. I was on a flight. Yeah. I was on a flight like back from San Francisco, but like the internet was so good on the United flight, I actually was able to watch it like on the plane. Yeah, it was like amazing. I was like, this is so cool.
That was sort of, what you were saying about the end of the impression at the end going a long way. I remember being on orthopedics, and the guy was, resident I was working with. He's like, dude, I set this bow, like, I did an amazing job. But if their cast is janky, they're not going to care.
Oh yeah.
If I do a splint that's terrible after I set the bone, they're still going to think I don't know what I'm doing. He's like, you have to be really good all the way up until the end. But that end, tie it at a nice bow and make a beautiful splint at the end, and that kind of emphasizes the care you provided. And I think a lot of times instructions, we hit a button, abdominal pain, generic, sure, and I don't think that's a way to cap off what you've tried to have, which is a very personalized encounter, very specific labs, very specific imaging, very specific instructions and plan, and I think that should come with discharge of instructions. So I don't know, that's kind of my tip on that lately.
No, it's cool. Honestly, I think we could have you back on a future episode. We could just talk all about that, like ways that we can personalize, better, even right now, even because I think people hear the word personalized medicine and they think, oh, it's like, this is like genetics and like all the craziness, which is also very cool. But like, there's so many easier ways to just make that experience for the patient feel more personal and not just transactional, not just generic. So, well, John, thank you very much for the convo. I wish we had more time to chat. but that just means we have to have you back, like I said, which is even cooler.
I would love it.
And
thank you.
What's, to wrap up, I guess, like, obviously you're active on social media, on LinkedIn, on X. I mean, I think, obviously in some of these like Slack groups, what would you suggest if people want to connect and start seeing what you put out there and connect with you? What's the best way to do that?
Yeah, I'm probably most active on LinkedIn. I had an interesting conversation with some other physicians recently, like, what's the best social media for doctors? And I feel like if you're a physician connecting with other physicians, you can get the little clip on, X that'll, link to their article, and that's phenomenal. But I think you can kind of take a deep dive with LinkedIn and say, here's what I researched it, and here's where I think it's going to make an impact. I think that's the same thing. I try to provide resources. If I go to a cool concert, or a conference, I try to, get the highlights out there. And so that's probably the best way to engage.
That's cool. And that's why I always tell people, I'm like, just follow me on LinkedIn. I was like, I'll follow you. I'll see stuff you put out there. It's a way to like just start building a community of, with yourself even on there. So
yeah, absolutely.
Yeah. Thanks, John. I appreciate it. Have a good weekend, rest of your week. And we'll be in touch.
Hey, thanks, Adam. Really appreciate it, buddy.
Thank you for listening to Efficiency Unlocked, Nerd Tested, MD Approved, a Nerd MD's podcast by Drs. Adam Carew and Dale Gold.